Hi everyone, good afternoon. Again, this is Richard Solomon of my YouTube channel, Chat and My Narratives, The Stroke Survivor. Okay, uh, today is a very different vlog regarding ivermectin. I believe you would find interest in my topic for today for the reason that anywhere in the world right now, as Dr. Pierre Corey of FLCCC put it, there's a strong resistance still and non-acceptance of ivermectin to 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 resolve our dilemma and crisis with uh, and with our crisis in with regards to COVID. Okay, so there's what he called the system. I believe you know what organization that is. The system is preventing the medical this medical scientist, the this their group who are well published uh, contributors in the medical science, the fields of medical science, top brass medical scientists who are who have made several and so many clinical trials and studies already with regards to ivermectin's efficacy, uh, its wondrous abilities in the combat of against COVID. So there's a big resistance, strong resistance in the US, in the most advanced countries, and even here in the Philippines. I was saddened by the news yesterday that I thought ivermectin, also as instructed by our president to uh, conduct clinical trials on ivermectin to the Department of Science and Technology. I thought there was it's getting better. The acceptance is getting better on ivermectin, but again, the news I've watched yesterday disappointed me because there's still a strong resistance and non-acceptance from this uh, medical government agencies in our country here in the Philippines. Uh, I don't want to mention them anymore. But at any rate, my topic for today is also related to this resistance. At least for you to know or what to do in case this resistance comes to you. Okay? Now, I would be reading to you what we call here as in our law, Philippine law, the patient's rights. The patient's rights. Like the question, do you have a right to tell the hospital and the attending doctors, the doctors who will be attending to you, to tell them that you would like ivermectin to be administered on you, to be the medication that you would like for you to take? Do you have a right to for with that? Do you have a patient's right for that? That is a big question, okay? So, and I would emphasize a certain word that is simple but very, very powerful that you could use later on, so you could assert your right with this, and that word is called conviction. It is mentioned in this Philippine law patient's rights in the Philippine law. So I would read this for just part of that. And I believe in other countries, whatever country you are in or residing, whatever country you, whatever nationality you are, I believe you have the same kind of patient's rights in your own countries. Okay? So I will just read this. By the way, the links of this, I will attach it, put this in the description so you can click that later on. Okay. Let me read it to you. This is with regard under the Philippine law. Patient's rights, the rights of the patients. Number one, so there's so many of this: right to appropriate medical care and humane treatment, right to informed consent, right to privacy and confidentiality, right to information, right to choose healthcare provider and facility, right to self-determination, right to religious belief even, right to medical records, right to leave, right to refuse participation in medical research, right to correspondence and to receive visitors, right to express grievances, right to be informed in his rights and obligations as a patient. But my topic for today only would touch I would touch only one on a particular right, which is the right to appropriate medical care and humane treatment. And it states here, every person has a right to health and medical care corresponding to his state of health without any discrimination and within the limits of its resources, manpower, competence available for health and medical care in the relevant time. The patient has the right to appropriate health and medical care of good quality. In the course, now listen to this, in the course of such, his human dignity, convictions, integrity, individual needs, and culture shall be respected. There's more, but I would stop on that. It says, the patient has the right to appropriate health. It says, in the course of such, his human dignity, convictions, integrity, individual needs, and culture shall be respected. Okay, now what does that conviction shall be respected mean? It means that whatever beliefs you had, culture, and convictions, and when you say conviction, it also pertains, if for example, you believe and you are convinced that Ivermectin will do you good in case you get hospitalized with COVID, and you want that this Ivermectin to be given to you in the course of your treatment. Now the question is, do you have right to assert that to the hospital that you were brought into and to the medical doctors who are attending you? Do you have that right? Now that's a big question to many, because most people doesn't know that. By the way, disclaimer, I am not a lawyer. You have to refer this to also to your lawyers. I am not a doctor. Still, you have to consult your, I hope you have personal doctors. But I was a journalist also before, other than I was a long time pharmaceutical medical representative, professional medical representative of a certain prestigious American multinational pharmaceutical company before, for 20 years. So why am I doing this and thus stating all this and sharing this to all of you? Because I, as a journalist, I also study laws of our country, and I'm very particular of this patient's rights and that word conviction, because you or we actually, wherever country you may be, as long as they're democratic country, laws, you have democratic laws there, we all have our rights with, as a patient, with our convictions too. What medicines, of course you don't know every medicines, but in this case you have heard a lot, or you have read a lot about ivermectin, and you have heard a lot and saw a lot of stories whose patients, from mild to severe, has been um, improved, if not cured, even cured with ivermectin, and you want that too in the event that you get hospitalized. Can you assert that right? And I tell you, yes. And basing on this, and I know you have a counterpart of this, patients' rights, your patients' medical rights in your country, assert it to them. Assert it to them, okay? Because you have the right of your own convictions to be respected. I hope you understand this, because this is critical. This is very significant. I am not praying to any one of you that you get hospitalized with COVID. I too, I am praying every time. That's why I'm taking care of my body every time, and with my family. I don't want to get hospitalized and be infected with COVID. That's why I'm taking my prophylaxis with ivermectin too. You see, I'm taking care. I'm preventing things to happen, especially to my health, and with this COVID crisis that we have right now everywhere. So what I'm telling right now is, in the eventuality that you are confronted of this kind of scenario, I would like to inform you that you have the right of your convictions to be respected for your medical care of whatever treatment, especially this, ivermectin, against COVID. You have the right to assert that. You have the right of your conviction to be respected by the hospital, by the medical community. Now, I'd like to cut it here, because I will be making another vlog with regards to a legal counsel in the United States by the name of Ralph Lorigo, and he won 6 cases, wherein that cases has six patients who had COVID and were hospitalized, and their families demanded that they be given ivermectin in their hospital during treatment. And these 6 cases, the hospitals and doctors refused to give them ivermectin. You know what? They filed the case, and legal counsel Ralph Lorigo represented them, made fought the issue with the judge. They were given go signal. The judges or the court demanded that their hospitals where their families are in, and their doctors, they were demanded to give them of what they need, and they needed ivermectin, and it was given. And you know what? Those 6 cases, and the courts won, and they also became, and they were treated in 48 hours. They get out of their ventilators. They were saved, and now are alive now, again back to normal. These 6 patients, they won their cases, and they all been cured of ivermectin. That's how dramatic this next video would be. Okay, so what I'm just telling now in relation to those cases in the United States, you as a patient has the right of your convictions to be respected, and that conviction, ivermectin, if you believe in that, and you believe in ivermectin, that is a conviction in itself. You assert that to the hospital. If they don't respect it, then file them a case. That's true. That's true. Okay? I'm not telling you to argue uh, argue with them immediately, but in the event that they refuse to give you what you are convinced of, that would help you, that would heal you, like with ivermectin, you assert that right. Okay. Again, I hope you find this very interesting and very, very informative for you. Please, my only favor is please subscribe. It would help me along the way to be, and especially to be inspired in doing more of this for for your uh, for your information, for your benefits. And let's save lives. Let's save lives. I love lives. I love us to go back to where we are, as normal as just like the our old normal lives before. Okay, so please subscribe, like, share if you may, so you can help to your relatives and friends uh, get be informed of these powerful messages. So with that, again, this is Richard Solomon, the stroke survivor, with my YouTube channel Chat and My Narratives, saying peace, God bless, and love one another, more so your families. Goodbye for now. Thank you. Bye bye.